Greetings. This is a case for the prosecution of the CDC, Part 2. Look at the CDC's organization, the Center for Disease Control and Prevention. So here's our mission statement: to protect America from health, safety, and security threats, both foreign and in the U.S., whether the disease is started at home or abroad, chronic or acute, curable or preventable, human error or deliberate. CDC fights disease, supports communities, and citizens that do the same. So, pledge to be diligent stewards of the funds entrusted to our agency. Base all decisions on the highest quality scientific data. Place benefits to society above benefits of our own. To treat people with dignity, honesty, and respect. And the role: detecting and responding to new and emerging health threats, and etc. You can pause this if you want to read these. So let's start by looking at the virus capital of the world. Remember, in this section we're looking at the organization of the CDC, how they're organized. So what's the virus capital of the world? China. Remember SARS, severe acute respiratory syndrome, came out of China. Coronavirus, bird flu, swine fever. Why China is still so susceptible to disease outbreaks? Well, because they do crazy stuff in China, like eat strange animals. New York Times, coronavirus outbreak risks reviving the stigma of China. Well, yes, because it's not reviving, it's an ongoing story. It never went anywhere. It's always been here, the stigma of China. It's a disease capital of the world. And then, Africa is another one, but they're nowhere near as bad as China. Take a look at the early COVID pockets of infection. So we have, I don't know what the date is on this, late February or early March. So the U.S. had 971 cases, and then he kind of added 1,000 every day after that, or several hundred. So the big pockets: Seattle, San Francisco, L.A., Boston, and New York. Does that surprise anyone? Didn't surprise me at all. These COVID-19 pockets left just happen to coincide with U.S. areas that have large Chinese populations. So it's not like, this is Chinese American bashing day. If you got all viruses from Bratwurst, we'd be looking at big German populations, right? Because people would go back home on the holidays and then come back with infections. That's what happened in the U.S. People went to Wuhan and came back and infected people. But if you look at the map on the right, I couldn't find a more recent one. This is a % Chinese map from the year 2000. Seattle, San Francisco Bay Area, L.A., Boston, New York. Look at the cities on the left. Look at the cities on the right. They're the same cities. Does that surprise anyone? It shouldn't, because if people are going to go home, if Chinese Americans are going to go home for Chinese New Year and celebrate and come back, and there's a virus going on, they're going to come back to their cities, and bad news for the cities. All pockets are located in the same cities with located in cities with large Chinese population. So why did the CDC not envision where the first signs of a pandemic would be? I think most people would envision that. I envisioned it. I could have told you where a pandemic would start. Name the cities, or the areas, geographic areas. Why would the CDC plan to require all medical professionals from key infected areas to send test kits back to Atlanta for testing? Look at the map. Does that make any sense? It doesn't make any sense to me. What do I know? I've just been a consultant for, a couple decades. A few decades. Okay, so why would the CDC not already have adequate testing centers in cities where the outbreak would occur, like Seattle, San Francisco Bay Area, L.A., Boston, New York City, instead of just in Atlanta? What do these people do all day? They sit around and smoke crack. Hey, let's open an office in Seattle where an outbreak might occur. Nah, let's smoke crack. This would likely not require new buildings, as this country has tens of thousands of hospitals. It wouldn't be a big capital investment. I took a picture on the right I've been using research centers for many, many years in my career. So this is a research center directory from 1989, which, probably, I buy these when they're a few years old, when they're only $50, because if you buy them new, I think they're like $1,700 a book. So, and then one a few years later, Research Centers Directory. And these things are like phone books. When you open them up and take a look at it, the print is really small, and they're huge. I mean, there's 2 volumes here. There's tens of thousands of research centers in the United States, okay? If you find somebody in Seattle and say, hey, you're a research center, you're a lab, you have everything we need, can we borrow a floor in your building or a room or something? It wouldn't take a big capital investment to have testing centers where we need them. Instead, there's offices around the country. There's one in Colorado. I don't know why. Maybe because Colorado has a nice new shiny airport. I don't know. There's one in Dayton, Ohio. I don't know why. Maybe they think some of those aliens from Wright-Patterson Air Force Base are going to come out and infect people or what. And there's one in West Virginia, probably has something to do with, mining and black lung disease. And then there's one in New Hampshire. I'm not sure what the function is on that. But these are little offices. And actually, some of them are pretty good size. But they're not testing centers. The testing center's in Atlanta. Then there's quarantine stations, and they have, all these yellow dots are a quarantine station, and they have a zillion of them all over the country in airports. So I looked into a couple of them and zoomed in to see if I could see where they were. Like in New York, I think it's at JFK Airport. And if you zoom in, can you see it at JFK Airport? No. Because why? Because it's a little room. It's like, you go to baggage claim, and then, you see these little offices or little sectioned off areas. One might say, lost baggage, and one might say, find ground transportation. The other one says CDC quarantine station. That's what we're talking about here. These are little tiny places that this is, it's good to have, an airport facility where you can quarantine people, but, it's not made for a pandemic. So I looked up the fact sheet on one of these, and this is the one at JFK, and they're generic. They don't tell you anything about how many people they actually, goes through quarantine in 1 year. They just tell you, major arrivals, JFK 14 million, LaGuardia 882,000, 753,000 cruise and cargo ships, land border crossings, Buffalo, Niagara, 12.5 million, etc. It's just stats, basically. Nobody tells you how many people actually went to the quarantine office at JFK. So this is another big failure of the CDC. How would these guys ever envision that they can handle a pandemic when people have to ask permission for a test, and then get permission, and then get a test kit, and then send the test kit to Atlanta and wait for results to come back? The patient's dead by the time that happens. That's what happened to our first few deaths in Seattle. They're waiting for a test, and the CDC killed them. They just let them die. This one doctor was, raising hell. He wanted his patient, an elderly lady, he wanted a test for her. Couldn't get it. She was near death, and the CDC said that she doesn't meet the criteria for a test kit. Why? Because she wasn't in Wuhan. She didn't come into close contact with anybody who was from Wuhan who was confirmed. So she can't have a test. So what happened overnight? She died. So, and then the CDC, thank God that doctor raised holy hell like I would have done, and the next day the CDC started changing their policy a little bit. Okay, we'll lift that requirement. We don't have any test kits, but we'll lift the requirement. CDC failure, major failure, not being able to see ahead enough to know that, their plan is not going to work in a pandemic. It worked for SARS. We only had less than 100 cases of SARS in the United States. So they think, well, that plan worked there. How about, several thousand? Does it work for that? No, it doesn't work at all. The CDC's lack of understanding of business aspects of the medical industry. This is the next section. So the CDC looked impressive for the first, coronavirus case. They had this little cool-looking little pod, that brought the patient in from the hospital, the doctor's office. A little cool-looking little robot guy, was looking after the patient. And, this was nice, but how many of these little pods do we have, and how many little robots? We're talking now 900 cases a day. Do we have, thousands of these little pods? They bring in a patient and they have to be, treated and, disinfected. And, how many do we have? We don't have 900 a day. I can guarantee that. Why doesn't the CDC have a better understanding of the supply chain deficiencies in the industry? Why can't Americans buy masks? If you've tried to buy a mask lately, you know that nobody has them. Walmart doesn't have them, your drugstore doesn't have them. Nobody has masks. Well, there's a couple reasons for that. One is somebody gave out an order for retailers to not, to return your inventory and not sell your masks to the public yet, because people are hoarding them and they're not being used, and the medical industry needs them. We don't need them yet. The medical industry needs them. So that made a little bit of sense. But then you look at it, why does the medical industry need masks? Why don't hospitals have 1,000 boxes of this stuff in their storage somewhere? Because why? Because the CDC never recommended, hey, stock up on your masks for the last 5 years, so that when they do come available, people can buy them because they need them too. So, why does the CDC not have a better understanding of the supply chain deficiencies in the medical industry? So we have on the upper left, here's a DuPont outfit here. And on the lower left, what is this? This is a truck packing up Tyvek outfits. This is a Tyvek factory in where? In Shanghai, China. And what they're doing here is sending truckloads of this stuff to Wuhan. Okay, Tyvek factory. All the stuff goes to Shanghai. So that's one reason. Tyvek built a plant in China because of cheap labor. But, I'm sorry, DuPont built a plant because of cheap labor. But those Tyvek outfits were supposed to come back to the U.S. So what happens? They get scarfed up by China. China just commandeers them. And that's why we're short on these things. We don't have enough for our people now. But China's pretty well outfitted now. Look at their medical people on the lower two pictures on the right. This happened, after China, after like 1,700 people got killed, who were basically the Chinese army, the army medics and nurses that were sent into Wuhan fairly early to man these big makeshift hospitals that were set up in convention centers. They didn't have enough doctors and nurses, so they sent in the army, but they didn't outfit them very well, and a lot of them died. So then they made a big deal of publishing to the world how many Tyvek outfits we have now. America doesn't have any. We built a plant there so that we would have some, but we can't get them now. Because why? Because it's China. So what do you think would happen if DuPont USA demanded, hey, China, send our masks and Tyvek suits and goggles back to the USA? Well, they'd say what they're saying today. Screw you. We're sending them to China. We need them. Why does the CDC not know anything about the global business world and Chinese illegal business practices? I could write a book about it. You want to look up Chinese business practices, look up Volkswagen, FAW, and Chinese intellectual property theft if you want to learn what Chinese people will do. So anyways, this is crazy that they didn't know anything about this. The CDC has no clue what our current inventory is of masks and outfits and goggles. Why not? You're the CDC. You should mandate that all hospitals check their inventory and bring their inventory up to what they would need to operate for 6 months if they threw away a mask every day. That's what they should be carrying. Why doesn't the CDC have a better understanding of supply chain? Why didn't the CDC know of a possible shortage in lab materials? On the left, exclusive U.S. coronavirus testing threatened by shortage of critical lab materials. Now, this is kind of generic, and they never really did list, what materials they're talking about here. But some of them, a lot of the stuff that they use in the lab is made in China. This is, partially U.S. manufacturing. We're producing everything in China, and there are lower cost markets. Why don't we make them in Vietnam or Thailand or Mexico? The U.S. has to get out of China. There's cheaper labor and there's not as many high quality workers, but, China advertises that they have a lot, and then they bring people in from the rice paddies to man the plants. So what does the CDC do when they see signs of exposures in a fight against a pandemic? This is an exposure, not having enough materials, not having enough supplies of what you need to treat patients, and drugs too. Another failure of the CDC. We're going to see a lot of failures of the CDC. That's why somebody ought to shoot these people. What has the CDC done to help out the 3 counties in Seattle? So why can't the CDC react quickly and enforce CDC policies and procedures at hospitals caring for COVID-19 patients? Well, this is patient number 1, which was in video part 1. And there was a New England Journal of Medicine article that went over step by step the person's treatment and every day at the hospital and what happened on every day. But this is the same doctor for that patient, but this is a couple weeks later after that person was hospitalized. It was a 35-year-old guy, Chinese-American guy. So, after, a couple of weeks, this doctor said, COVID-19 has been circulating unchecked for weeks. Why? Testing delays, and we already went over that in part 1. And circulating unchecked. Doctor of patient 1, some hospitals still haven't instituted strict isolation protocols for everyone being tested. Why not? I mean, hospitals ought to be ready. They ought to know what the protocols are, and they ought to practice them. It's like practicing a fire drill or practicing, evacuating a building. I guess most of the time you do that, it's for a fire drill. Oh, it could be for a tornado or something like that. But, you practice things happening all the time. You practice mass accidents, and it's not like the CDC doesn't know a pandemic can happen. I mean, watch the Discovery Channel where they give you all these, there's one show that shows you 10 different ways the world will end. Well, a virus is one way. So we need tests. Our people will die. Whatever the issues were in getting tests ready, overnighting some tests from Germany would have saved lives. So here's just a bunch of mad doctors, mad at the CDC because, the guy in the upper left, Seattle, there are a lot of patients that died there. 6 people died before they could get a test to the county. So, Americans died due to a lack of action on the part of the CDC. 6 people died from that facility now. I think the deaths from that one facility is over 30 now, 32, I think. And, people died because they couldn't get a test. They couldn't determine what was wrong with them, and they couldn't get treatment because they hadn't been, tested to prove that they were positive for COVID-19. So, you get a bunch of mad doctors, at the CDC, and they're just as mad as I am. This is, a doctor on the right shows you how I feel about the CDC. It's just a bunch of morons. It's like they can't anticipate anything. They never, heard of the concept of a pandemic. This is a pandemic now, and you guys aren't ready. You never were ready. A case for the prosecution of the CDC. So, due to their incompetence, the CDC is directly responsible for the deaths of 85 Americans so far. So it's up to 85 now. I'm using a little bit more current. I started this video and this presentation maybe 3 days ago. So it goes back in time only like 3 days. But we have 85 deaths right now. And, why do we have 85 deaths? Well, a lot of times, the patients, it's not like the patient made it to the hospital and died in the hospital. They died before we even knew they had COVID-19. Because why? Because we didn't have any tests. We don't know who, still to this day, we don't know who in this country is running around with this virus, with a viral infection. Every single one of these people, from the director, this is just most of the management of the place, should be held responsible, personally liable for the deaths of 85 Americans and counting. That's of 315. I think that's actually of 316. And for the deteriorated health, the deteriorated health of thousands of other Americans. In part one, we visited this. How many people do we have in the hospital now? Thousands, several thousand people. Everybody who's ever gone to a hospital to get treated for COVID, who were positive for COVID-19 to get treated, they're still in the hospital, except for 17 people that got out. Other countries have, China has over 60,000 people that were, released from a hospital. We've got 17. God. This is the former director. He's calling for an investigation into testing failures. Something went wrong. Yeah, something went wrong. Is these guys, they had no clue. They never watched these, shows about, a pandemic wiping out half the people on the face of the earth. They didn't think that was actually possible. They just knew the word pandemic, but thought, nah, it'll never happen. Well, SARS, we had, 40 cases of SARS? Very, very little. And MERS, we had even less. That was a Middle East respiratory syndrome. So, it hasn't hit the United States in really big numbers yet, but, why aren't these guys ready? Why don't they check the inventory of masks and the inventory of, suits and protective gear and the inventory of lab equipment? Why doesn't the CDC mandate that hospitals carry a certain level of inventory of everything? And then the testing, something went wrong. Yeah, the CDC couldn't make a test that worked and didn't have any tests. And then we had to change the laws and regulations to get other private labs now to produce tests. And now we've got tests, by the zillions. The South Korean model. So how did South Korea outperform the U.S. and everybody else in the world? But everybody outperformed the U.S. in getting COVID-19 under control after being an early epicenter. So the reason they were an early epicenter was due to this crazy church that they have. It actually has 1,000 churches in South Korea and 450,000 members. So this is another crazy Christian, where the leader thinks he's chosen by God and talks to God and all that kind of stuff. And he's got a lot of members, and some of these members were in Wuhan recruiting Chinese people to come and join his church. So that's how the infection started. Somebody came back from that and got this woman infected, and this woman then infected everybody in the church. So it went from 0 to a couple thousand. You could see that on the upper left, South Korea COVID cases soar past 3,000. And then on the right, South Korea viruses continue to slow at 8,000. So it went from 3,000 to 4, 5, 7,000, and then it kind of stopped at 8,000. And the reason is that South Korea has things under control. And how do they have things under control? Here's the first reason. South Korea used the Chinese model of disinfecting everything. You can see these people walking around. I think this is actually army people walking around the street spraying, spraying the ground. I don't know how much good it does spraying the ground, but they'll spray anything. They'll spray the doorknobs and the windows and, everything. Makes people feel better too. And on the left, you can see some trucks going by with spraying disinfectant. And behind them, it looks like it rained. And then on the right, it looks like a subway station. So here's a second thing that Korea did, South Korea. They used CVD virus information that was passed out to the world from the WHO. They never had a virus. They never had a sample of the virus like the U.S. did. But they made test kits without ever having a sample of the virus. They used artificial intelligence to help them detect the COVID-19 genes. So the World Health Organization actually published this thing in the middle here from CNN, where you have an E gene, a RDP, RP gene, and an N gene. The idea was to detect these genes because that's what this virus has that other other coronaviruses don't have. So they actually made the test. This, new company, Gene, they hired a bunch of, PhDs, and they started making these tests. And in 3 weeks, they had the test kits made. And, I don't think anybody else in the world has made a test without actually having the virus. So that's the second good thing they did. First, they disinfected everything, then they made these test kits. And then they started making them by the zillions. They, upscaled that. Then what did they do? They invented this. Here's people in Tyvek suits walking up to cars saying, give me your driver's license number, give me your driver's license, I'll scan it, and then I'll take a little swab of your cheek and you can go on your way. And, we just put the swab in a test tube and, we test it in a couple hours and, they can get enormous numbers of the population tested just by stopping cars. Just think of how many cars ride around in a city like Seoul or, some of the other big cities. South Korea's drive-through testing for coronavirus is fast and free also. In South Korea, a leader in coronavirus testing capabilities. This came out today from NBC News. 15,000 people a day are tested. Do we have 15,000 tests altogether? We're supposed to pretty soon, but we're way behind testing people. And that's another issue. What do you do with them when you test them? So on the bottom, South Korea reacted fast to lockdown Daegu, the epicenter. But guess what? They haven't locked down any other cities. South Korea is not under lockdown. Not at all. And they've got the cases under control. New cases are way less than 100 every day, less than 50 new cases every day, and that's all coming from the church. Actually, I think it was like 80 yesterday, but 40 of those were from church members again. So they're trying to get the church to cooperate a little bit more. Followers of the Doomsday Church say that's linked to that's linked to the outbreak. We're meeting in Wuhan until December. So that's something I just told you, that they were actually in Wuhan up until December and came back with the virus. Daegu and lockdown. This is where there's all kinds of churches. There's 1,000 of these churches in South Korea, and Daegu is just where one of them is, and that's where the outbreak happened. What else did they do? South Korea started using American drugs, namely a drug called Kaletra, a combination of two other American drugs, lopinavir and ritonavir. Those are, like it says right here, South Korea experts recommend anti-HIV, anti-malaria drugs for COVID-19. So both of those drugs that I just named were from Abbott Laboratories. And Abbott Laboratories spun off this little company called AbbVie Incorporated. And AbbVie makes Kaletra now. And Kaletra is the miracle drug that South Korea is using. And that's why they have so many recoveries. We looked at that a little earlier. So none of this stuff that they're doing is rocket science. Spray everything down to eliminate community spreading of the virus. Make your own test kits. Test people like crazy by the zillions. 15,000 people tested every day. It's pretty easy to find out who's infected and put them in quarantine, and use American drugs. That's anybody could do that, but South Korea did it. Another CDC failure. No place in the United States is being hosed down and disinfected now. And actually, San Francisco Bay Area, there was a picture a couple days ago of some nurses in the Bay Area doing car testing now, taking swabs of a mouth. So we're starting to follow South Korea's lead, but we're way behind, and a lot of people are going to die before we catch up. CDC national advisories, or lack of. So this is another thing that I find weird about this. This seems like, CDC comes out and makes a recommendation every so often, like the recommendation to not gather more than 50 people. But for the most part, individual cities and states are making all their own decisions. New York is to close city schools. Well, first they said they're not going to close the city schools, and then the teacher said, we're going to call in sick, all gazillion of us, and you won't have any school anyway, so they decided to close schools and bars and restaurants. And in the middle here, California, Ohio, Illinois, Massachusetts, and Washington closed bars and restaurants. So that's, like Massachusetts and Ohio, really, really low counts of coronavirus cases, COVID-19 cases. And they're just really proactive in, closing bars and restaurants. Like Ohio, I think 37 cases is what they had when they closed all bars and restaurants. 37 cases in a state that has 11 million people. So, that's good by them, but some cities might wait until half the people in the city are infected. On the right, new rules announced for nursing homes. Well, yeah, that's a good idea. That came a little late too. Screening all visitors, employees, and volunteers, and they must be screened for symptoms at the start of each shift. So, yeah. Otherwise, you kill people. You kill old people. You carry a virus around. Maybe you got a sore throat or a cough, and you're going to kill an old person. They're going to have, pneumonia and organ failure. The U.S. Department of State advised against cruise ship travel. Do you hear the CDC coming out and saying anything? That's the Center for Disease Control. So the Department of State says, cruise ship travel just isn't the way to go. They're virus incubators. There are no advisories that prohibit anyone from a sickness from boarding a commercial airliner. All you have to do is pop a couple pills that, lower your temperature, and you can get by the checking areas and airports and get on an airplane and go to China to get a, coronavirus test, because you can't get one in LA. This woman ought to be shot, by the way. China announced on 3/16 that anyone who conceals their sickness will be convicted. It says their conviction for concealment. This is one of the stories off of Baidu that I go over every morning on the other videos, the daily videos. Infected persons or suspected persons who conceal their sickness and travel around are, they're going to be arrested, and that's good. Somebody ought to come out and do that for. What else are we not doing? Why is the USA taking a disconnected approach? So this is the next thing. King County, Washington, 37 deaths, 40 as of 3/16. And Washington has 48 of the country's 85 deaths. You can see the lower graphic here from Johns Hopkins, 85 total deaths in the United States. In Washington, we have 904 cases, pretty alarming. That's a big number for a county, actually. Actually, it's 3 counties, but it's one very, very small geographic area south of Seattle. Deaths 48, recovered 1. So 904, 855 active. Though only one got recovered. That was the first patient in the United States, and 48 died. So why isn't somebody advising the National Guard, get out there and lock down the county? Just put roadblocks on every road leaving the county. Nobody in, nobody out. That's what Italy did in northern Italy, and that's what a lot of countries are doing. That's what South Korea did in their epicenter. You have to lock down the county, then start testing everybody in it, and get people isolated when they have the virus. There's a lot of things you can do, but you have to start by locking down the county. What else are we not doing? Why isn't someone ordering that King County public roads and public places be disinfected? There's no doubt now that people are being infected by community sickness in those Washington counties now. And you don't see Americans walking around with hazmat suits spraying disinfectant everywhere. I haven't seen that anywhere in the United States yet. Why is everything from the CDC too little and too late? CDC recommends no events of more than 50 people. That's the first time I've heard them come out and say something, in a long time. They don't come out and make announcements. That's what this whole section is. Why is everything so disconnected in the United States? Every little city and town is doing their own thing. There's some county-wide things going on, but there's no, there's governors saying we're going to shut all restaurants and bars. That's good. But somebody in the federal government ought to make some policies based on CDC recommendations. Like if your county gets a certain percentage of infected people, your county is going to be shut down. Doesn't matter where it is. So the solution for the CDC. What is the solution for the CDC? Disband the organization. Even the name is a laughing stock of the world now, and we shouldn't rehire anybody in the new organization that replaces the CDC. Just do away with this organization. Nobody in here knows what they're doing. They're all smoking crack. This whole pandemic took them by surprise. They weren't prepared. That's what they're supposed to do. They're the Center for Disease Control. They're supposed to anticipate things like this, like a pandemic. They're not prepared at all. Our hospitals are prepared. Our hospitals are great. But, you got to get people identified to put them in a hospital. And then the CDC is not doing a very good job of passing out drugs to give them the right treatment. We have several thousand people in the hospital that went in and never got out. They're still there. These people aren't doing anything right. Just get rid of the whole organization. Start a new organization under more centralized control, people that have brains, people that can anticipate things. These guys have to go. And they have to be personally liable for all the deaths that they've caused.